Hey guys, this is Bree here with New Mom Monday. I am a mom of 3. We just started our show 3 weeks ago. I've got a 12-year-old, a 3-year-old, and a 3.5-month-old, and we are here to tell you tips and tricks of all of our journeys here. Drop the nook. We're all good. From going from a very non-natural emergency C-section birth to a third very happy, healthy natural birth. So today I am joined by Dr. Mitch.
Hello everybody, thanks for joining us on Monday.
Dr. Mitch actually works here in our Green Bay clinic. He has adjusted me through my last pregnancy because you weren't here the other ones, and now adjusts baby Jackson. And last week we were talking about colic for babies and stomach issues, and chiropractic obviously is one of the big kickers for my family. And he started to explain some different things on the different nerves for the body, and I said, wait a second here, we've just got to get him on to do a show.
Right, because it's very, like, birth is traumatic, right? I mean, it's exhausting, it's frustrating, it's difficult, it can be long, can be, I mean, depending on what you might have going on. Birth
I had a cousin who was vacuum sealed out, or not vacuum sealed.
The suction, the vacuum cup on the head, stork marks sometimes too. Like I said, even you had the emergency C-section. All of those are definitely necessary because priority is to get the baby out, right? Get the baby out healthy and make sure everything is going well. But there are a lot of issues that can be put on that baby as soon as it comes out of the birth canal. I mean, it's a lot. I mean, it's moving through and the joints and everything is moving and trying to pull and trying to do this, and that puts direct trauma on the nervous system.
I would say, especially nowadays, you wouldn't know this because you haven't had a baby, but the medical community really I mean, they tell you, we're not trained as women anymore to let our bodies speak. So I remember going into my first birth, a hot mess, and my second one still nervous, this one much more prepared, and going, I will tell you when I'm ready to push. I just knew. And nowadays they're pulling, and I mean, even worse than I feel like.
Right, it's all just like I said. Their idea is, I mean, which is not bad at all, but get the baby out.
Got to get the baby out, but
right, in whatever way necessary. But 2, you need to understand how the body works and how everything's functioning. Right, talking about how you're letting your body speak to you. Right, just like with Jax here.
He's got a lot to say.
I know
today.
that is the thing, is that your body knows everything. Right, from the day you were born, you're programmed. All of these different things are ready to go. Your innate intelligence tells you what exactly it needs to do. Yeah, and so the big thing that controls all of that, right, is the nervous system, and that's why getting adjusted is such a big deal. Because specifically, I mean, this is, like I said, bringing up this poster, because this is how specifically the chiropractic approach. There's those 3 T's, right? Traumas, toxins, thoughts. Actually, I did a video on this the other day on Friday too, because I was like, this is good, I should probably talk about this. But for babies, is that depending too, if mom's not feeling well, if there's sick moms make sick babies, right?
That was my 12-year-old, see that?
Yeah, so if there is some foods or something that you're doing, possibly through the breast milk or passing along through the placenta, through the umbilical cord, then there's going to be some toxins, right? There's going to be some things that are going to directly damage some of the organs, get specifically in the stomach, right? But now, like, now understanding what some of those things are, and you're much more prepared moving forward into this pregnancy, is that this is the big thing that's going to control everything. Just getting rid of some of that trauma that happens. Because in our autonomic nervous system, right, this runs our reflexes, is what we do without even thinking. We have our sympathetic nervous system, which is our fight or flight response, right? Everybody's heard that. When we have some sort of damage that's going on, when we have a stress on our body, then it throws our body into that fight or flight mode, and it turns on all of these different sympathetic chains, which is going to be these, I guess the yellow, if you can see the thing, see the poster here, it's going to be these yellow pictures. But also there is the parasympathetic side of things. That is the rest and digest, okay? So when our body is not under stress, then it can rest and digest and move things through and make sure that everything works properly. Yeah. And so specifically why the cervical spine is so important, okay? Because that's where, I mean, it's where brainstem is, but that's where majority of actually cranial nerves, and some of these cranial nerves are part of that parasympathetic nervous system, okay? So if there is a little bit of dysfunction that's going on here right at the top of the cervical spine and into the skull, this is the big one, this is your vagus nerve, right?
Yep.
We talked about this.
Yeah.
Cranial nerve 10, yeah. And what that is the wandering nerve. It goes everywhere throughout the body. So it works on the heart, works on the lungs, works on the stomach, blood vessels to the internal visceral organs, liver, pancreas, adrenal glands, intestines, large intestine.
So that nerve hooks to the stomach, in layman's term.
Right,
And
right.
I've got a baby with colic, and something is off with his cranial nerve. That can be causing the distress,
If
stomach
there's
issues.
a little bit of dysfunction that's going on here, that body's not going to have the signal that gets sent through the stomach in the right way. Vice versa, like I said, if there is some other toxins that are going on irritating that stomach, it can send that signal back to the brain and create some of that dysfunction that way, right? And so even having some sort of spinal misalignment, right, talking about a subluxation, some sort of dysfunction that is going on there, that is stress on the body. It creates inflammation, turns on your parasympathetic nervous system, turns on your sympathetic nervous system and shuts down the parasympathetic nervous system, and then his body's actually not going to want to properly digest and absorb some of those certain things.
So another thing that I noticed, now we talked about it in a different show, but I only feed for a while off the left side. So without his adjustments, and when, I can notice, so we get him adjusted always every Monday because we're here. He's here on Mondays. If I'm not here at the end of the week and being good and getting him adjusted at the end of the week, by Saturday, Sunday, because he always eats off the side, his head is, we'll be talking to him over here and his head is this way. But then when I can get that adjustment in,
relieving that stress.
Yeah.
And that's the thing too, is that getting adjusted is important because every day we do some sort of repetitive motion, or we're sitting in a chair, or we're carrying something that is constantly putting stress on your body.
But I've heard people say, well, my baby doesn't carry boxes. Well, does your baby favor one side or the other? That's
or
what we're dealing
even
with.
They're carrying around that big old melon that they have,
yeah.
right? They're not strong enough to hold that up yet.
They don't even have a neck.
Yeah. Even just in certain sleeping positions, you get stuck certain ways. It's basically that continuation of just your body gets stuck in that same repetitive motion, and you need to help work on getting that out.
So I've had explained, because this one is fun, I've had where my babies were adjusted and they pooped instantly.
Yeah.
Whether they were constipated sometimes or not. Explain to us why you see that.
Okay. So again, talking about the parasympathetic nervous system portion, right? The rest and digest, keyword there, digestion, okay? So there is actually a whole technique that is called SOT, sacro-occipital technique. So it's working on the occiput, which is where your head is, where some of that parasympathetic nervous system is, talking about that vagus nerve. And then down here at the sacrum, which this is where actually control, specifically in babies, a lot of that large intestine, right, the colon. So making sure that if there is some sort of, like I said, if this signal is not reaching the large intestine, then he's going to have difficulty pooping, right? Everybody poops, right? That's the book.
Girls don't poop.
And so making sure and relieving whatever type of interference that can be going on there, relieving that inflammation that causes dysfunction, causes disease, and letting things flow naturally in the way that it should work, and happens right away. It's always in the sacrum. And so you get that button, the push poop button in the sacrum, and then things just move because it's relieving inflammation off the body, and then things run normally.
Well, it makes me sad. I'm in a lot of different mommy groups on Facebook, breastfeeding, and we're going to actually do a show on all the different resources. But I hear people say, oh, my baby hasn't pooped in 2 weeks, usually does every 8 days. And you get 10 moms, which it can be up to, 5, 6, 7 days with a breastfed baby. But you get 10 moms that say, feed him prune juice. And I'm over here with my Wellness Way training saying, no, why don't we find out in the first place, or my favorite, Caro syrup. Give the baby I have to give my baby Caro syrup regularly in order for him not to be constipated.
Right.
Why don't we figure out in the first place why
some
they're
of those things are
consistently
happening in the
constipated.
first
So,
place. And that's all it is.
It's not common knowledge for moms to think that way. We're not trained to think that way.
Right.
So that was my goal, is starting the show, as being a resource to these moms to say you can think differently.
Right, because that's kind of the thing too, because we're constantly always surrounded in this environment.
Yeah.
So this is just the way that we think, and it's totally normal and it's natural.
People have to say, on the show, you might have to dumb it down a little bit, because I forget where we are. You got to start somewhere.
Right.
But
right.
I do get, why do you get your babies adjusted? And for me, it's just second nature. We have family. Okay, today we're family trip to the chiropractor.
That's what you
so
do. Like I've been getting adjusted since I was 2 months old. It was just always something that we did. Every time that I was sick or I was like, Mom, we got to go to the chiropractor. Like, that's what we had to do. That's
awesome.
just what it was. And I mean, the big reason why, because of that, I have an older brother that had a lot of ear infections. And he got adjusted probably when he was like 4 or 5. And then when I was 2 months right away, and I really never had any issues with it, never had any problems with it.
Yeah.
Because it's all about, like I said, it's all about that function. It's all about how that nervous system works. And your baby is not constantly bombarded by things that actually, because as I always say, it's the things that we've done over time that really screw us up, right? Baby's newborn, young, fresh, hasn't had that time to do that, right? So it's all just about the nervous system that's controlling all of those different reflexes, because they're going to develop and understand and know how that body works. But right now, it's just his innate intelligence that's telling him what to do, right? It's everything like, he's not thinking about pooping or thinking about eating.
Yeah.
It's his body telling him, I'm hungry, I have to go to the bathroom.
Oh, that's a really good way to put it.
That's what the baby does. And so your nervous system controls that.
So we'll touch one more thing, and then we're going to adjust baby Jackson, because he hasn't gotten his adjustment today. Usually we do it first thing in the morning, but I get a lot of people that say, it's scary to adjust a newborn.
I know, it's so funny.
What? So we're going to do that, but you touched on ear infections. Explain why chiropractic for that. So what are you guys doing? When I brought Jason, this last winter, for an ear infection, we don't use any antibiotics. We didn't have to. What were you doing?
So basically, again, it's just removing interference is what goes on. So a lot of times it's not even the fact that it's a bug that can be creating some of that, right? It actually, if there is some restriction in your cervical spine that actually connects to the ear, also too, there's the eustachian tube, basically things flowing down, always trying to drain. And in babies, that's not quite developed yet, and it's still more horizontal. So when we get older, it actually starts to tip downward a little bit, so it's going to drain a little bit easier. And sometimes when there is a little bit of irritation, right, a little bit of inflammation, if this joint is not working correctly, it can clog that up, and it can build and build and build some of that normal flora that's in there doesn't get released, and it can create some sort of infection that way. But like I said, it's not necessarily something that is like a bad infection, that's something that was contaminated or whatnot. It's your body's own normal flora that just grows in a place where it shouldn't.
So if I give antibiotics, not only am I going to have harmful issues to my gut and destroy some of my beneficial bacteria, I'm not getting to the root issue, which is why we see, before they come to us, we see all these kids with repeat ear infections.
All the time.
And you see them on antibiotics again and again and again and again.
And then tubes get put in the ears, tonsils, adenoids, all those things out, right? Because tonsils, adenoids, it's a huge immune system function. So again, something that's overgrown, not supposed to be there, your immune system responds to that. And your body knows how to work normally.
Yeah.
It's just figuring the things out that we're doing that make that dysfunction. And we just got to get out of the way.
Awesome.
Yeah.
Well, is he almost sleeping? Yeah. Usually he's sound asleep or super happy for his adjustments. He's a little tired today, so if he cries, that's why. But we had to wake the star up for his show.
And the big thing, too, talking about adjusting babies, is that it is not even close in comparison to what you think to, even an adult or even just a grown child. Because babies, babies had not had time. Like, they don't know how to fight you. They don't know what a subluxation is, right? They don't know any of these things. So all that it is, it's really just looking for symmetry. Because you can even see now, his head is just a little bit to one side, right? And you just work on actually doing some specific reflexes. Yeah, just seeing how things are moving. And 2, it's very, very simple. Like, you basically just walk up the spine and you can feel where there's just a slight amount of tension, just a little bit tension compared to one side to the other. And all you have to do is just put a little bit of pressure on there because
Look
they
at
don't
that
know.
smile. I wish they could see the smile right
Because
now. Hi.
because they don't know how to they don't know to fight you, right? They just know that, oh, this is a little irritated, and we just got to work on pushing it a little bit. Yeah, right there. And especially too now, like as babies are getting older, like there is changing, right? Their head gets stronger, and they
Yep.
are going to put more stress on their body. So specifically here, as he's holding his head up, he's going to put more tension actually in his thoracic spine, right? Because that's where all the muscles are. And so it's just easy little boop, boop, just like that. And then working on,
Are you ready for a
yeah,
nap?
and then just
I
working on
noticed
hip
with my
strengthening too.
newborns, I mean, he's still very fresh out of the oven, but I don't notice him as a newborn anymore. I mean, when we would come in while I was on maternity leave and get our adjustments, just out cold afterwards. I mean,
Always.
a few times. Are they breathing?
How many
checking
times
in?
actually when Krista, when brought baby Zoe in here, she on the way home always would have a blowout in the back. Always.
Yep, a poop and a nap. I mean, they're just.
And this is all it is, because they don't have, basically those joints aren't fully even developed yet.
But this is our families. It wasn't always with the 12-year-old. It was run to urgent care. It was run to the doctor. It was called a pediatrician.
Yeah.
Now our families is, we need to call the chiropractor. We need to stop at the doctor's. We need to.
Hi.
Our
And
doctors.
especially too, like everybody gets scared in the cervical spine and the neck, and all it is just putting a little pressure on those areas that you feel some of that tension, and it just melts away. It's so simple. Yeah.
Are you ready for
And
your
you know
nap?
nothing
Did
of
we
it.
wake you up? He had just fallen asleep 20 minutes
There.
before the show.
And,
But he will fall right back asleep
yeah.
after this.
and there you go. That's it.
Awesome.
Very
Well,
simple.
Nance, do we have any dire questions that we need to answer before we pop off? Awesome.
Perfect. Like I said, just some very simple tricks and why getting adjusted at a young age and actually throughout life is so
I
important.
mean, there's so much more.
There
we
is.
could go
I mean,
for 3 hours
yeah.
listing off the.
I mean, we got patience to
yeah,
see.
you got patience to see. Listing off the benefits,
Yeah.
but it's not scary.
No,
We
like
do
I
our
said.
whole family on the regular.
It's just removing that interference, removing those things that are causing that disruption in the body.
Yeah.
That's what chiropractic is.
Awesome. Well, thanks for coming.
Yeah,
Thanks
thank you
for joining
guys.
us.
Yeah.
We'll see you guys
So-
next week.